KIRO, Seattle.
This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo.
Governor Inslee says reopening the state's economy will take place in phases.
This transition will not be a light switch, on and off. It will be a dial.
But he says two things have to happen before businesses reopen. We'll tell you what they are.
Bill Gates calls the president's decision to halt funding from the World Health Organization, quote, as dangerous as it sounds.
And thinking of escaping to the San Juan Islands during the outbreak? Not so fast.
There's concern that incoming individuals who may be carrying COVID may, increase our exposure.
More on the plan to keep tourists out of San Juan County.
Stay with us.
When will Washington's economy reopen? Today, Governor Jay Inslee said a few things need to happen first.
First, our social distancing has to be successful enough that we drive down the number of infected people where we can be confident that we're not going to have the curve start to rebound and go up again.
And we'll have to build up a brigade to rapidly test people who get sick.
A person with symptoms can call, get tested immediately, be isolated immediately, and we can contact trace, go to all the people that they've contacted who potentially could have had the virus transmitted to them. And that takes a lot of legwork.
Is that what you called this, Aaron, a brigade?
Those are his exact words, yes. A team of people who, if somebody gets sick, they can call, and then they can be able to contact trace. Now, what that looks like in terms of contact tracing, that's still unclear. What technology could be used to do that, because right now that technology, it exists in a way, if you want to use Bluetooth from your phone, for instance, to try to reach out to everybody you came into contact with. But the governor said that, that raises a lot of ethical questions.
Right. So what about lifting restrictions before May 4th?
Yeah, he was asked that specifically, and right now he says doesn't look like that's going to happen.
That is unknowable. There is some possibility that those things could happen. If you look at the modeling, it would suggest probably not, given the rate of the curve at the moment. Could something happen to seriously increase the decline we're experiencing? Possibly.
So that decline, by the way, that is also, of course, one of the main factors here. We want to continue to see that curve continue to drop, see the infection rate drop as well. And then we also want to make sure we have enough personal protective equipment in our hospitals in case there is a second surge. And we want to get the number of tests up and running more. He mentioned that there are 1 million supplies for test kits coming to our state right now. Interesting, though, because, gosh, the testing capacity here is actually really good. We can do 13,000 tests a day if we wanted to, but because the supply is so low right now, we're only doing upwards of 4,500. That's not good enough.
Well, right. And even if you did do it at capacity 13,000, it would take a year and a half to test everybody in Washington State. So if you're gonna open up a community based on the infection rate, you don't know that until you've tested everybody, right?
I know. Yeah, and that's the thing, is there are so many questions right now. So what it sounds like, though, to me, is that it will reopen, unclear when, but when that happens, there's going to be some element of social distancing, whether that be, continuing to tell people to stay 6 feet away from each other, limiting, people going into restaurants, requiring people to wear masks if they go out. As for public events, I don't know. I mean, I don't think that's going to happen this summer. I don't think large gatherings are going to happen in the coming months unless we seriously somehow scale up testing.
Well, the plan that was released today, or at least was published in the Washington Post from the CDC and FEMA, said that the first thing you should reopen would be childcare and schools, because people have to have a place to put their kids before they can go back to work. And then you reopen essential workplaces, followed by restaurants and bars, followed by general workplaces, followed by social gatherings. Not sure exactly what that means, but it sounds like it's pretty small. Then high-risk facilities. That, it seems to me, would include your theaters, your stadiums, your cinemas, and then finally colleges and universities. Is there any indication that he has set up some similar hierarchy for Washington State?
Yeah, I would say so. His analogy today was it's not going to be a light switch, it'll be a dial. So the way that we turned it on, think of that in reverse. So the fact that we closed non-essential businesses last, I would think some of those non-essential businesses would come back first. The way that we closed large gatherings first, I would expect those to come back last.
Yeah. All right, so they're working on this now. We still don't have a date. We still don't have sufficient testing. So people are saying, when do I make my plans to go out for the first time? We just can't tell you that now.
No, and I don't know about you, David. I'm feeling like the sense of the general public right now is they're anxious, man. I mean, they've been anxious now, but now there's a lot of pressure. And I know the Trump administration today says it's going to release some new guidelines tomorrow for social distancing. I mean, you got the sense that when the president says he's going to scale back some of his restrictions, that certain states will follow those guidelines. And in our state, I don't think it's going to be one of them if it's on May 1st.
I think it may be up to the businesses themselves when you get right down to it. I mean, I'm going to want to hear, before I go to a restaurant, for example, they have in the window the smiley face, which is a way of displaying what the inspectors found in terms of cleanliness. There's going to have to be, a COVID face.
Yeah.
Where, they tell you that at this restaurant, for example, we wear gloves, we wear masks, the tables are 6 feet apart, or something like that. I think people will want to hear, the restaurants obviously can't exist like that forever because they can't serve as many people, they can't make as much money. But I think people will have to be persuaded to come back and trust it. And the businesses, a lot of that's going to have to be on them. President Trump is suspending hundreds of millions of dollars in funding for the World Health Organization, accusing it of covering up the outbreak and being in China's corner.
Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death.
And this is a big deal for the World Health Organization because the U.S. is the agency's largest contributor, making up nearly 15% of its budget.
The second largest contributor is the Bill and Melinda Gates Foundation. It accounts for about 10% of the health organization's funding. Melinda Gates spoke with CNN last week about how that agency has helped us through other epidemics like Ebola.
The WHO absolutely needs to be funded. We have worked with them for well over a decade as a foundation, and they need to work with us on a coordinated response as a global community. So they're fundamental to this.
Bill Gates on Twitter today said the president's decision to halt funding is, quote, as dangerous as it sounds, adding the world needs the WHO now more than ever.
And the president's gripe seems to be that nobody is questioning China's numbers. He can't believe that the United States now has the most number of infections when the epidemic began in China. He thinks China is covering up, and he thinks that the World Health Organization has been enabling it. San Juan County, picturesque, remote, says it loves tourists. Just not during the outbreak. Bill Watson is San Juan County Council member. He says they need to keep the virus from spreading because the islands have limited health care resources.
San Juan Island is the only island that has a hospital on it. It only has 10 rooms. The other islands only have clinics. We're concerned about exceeding our abilities to actually serve not only the residents, but any potential visitors.
And Watson says they're also concerned about their older populations.
Our average age in the county is 54, I believe is the right number. So we have a more vulnerable population here. And so we're just concerned that incoming individuals who may be carrying COVID may increase our exposure.
The new restrictions prohibit all non-essential visits, and that includes people who own vacation homes on the islands. Boaters are also banned from docking in the marinas.
Councilmember Watson says their county only has 13 cases of virus and no deaths on the islands, and he wants to keep it that way.
We could get impacted fairly significantly here. So we're trying to leverage our natural geographic separateness at this time and benefit from that and keep the number as low as possible.
The travel ban runs until at least the governor lifts the state's stay-at-home order.
But there is still a chance to see the San Juans virtually. The Visitors Bureau is offering a number of scenic videos to enjoy the islands from your computer. So there's at least that.
We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast. You can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.